Diabetes is the 17th leading cause of death in the United States. Diabetes is a major cause of heart disease and stroke. Causes of this disease, type 1 and type 2.
Type 1 diabetes is caused by a lack of insulin due to destruction of insulin-producing cells in the pancreas. Hereditary plays an important role in determining who is most likely to develop this type of diabetes. It can be found in the genes passed down from parent, since genes carry instructions for building proteins in the body. Some people may be diagnosed with type 1 diabetes after or during a viral infection.
Causes of type 2 diabetes. This is the most common type of diabetes, with various factors causing the disease, including genetic likelihood of being affected, obesity, physical inactivity, insulin resistance, abnormal glucose production by the liver, and cell dysfunction.
Symptoms may develop rapidly with type 1 diabetes and slowly and subtle with type 2. Prolonged high blood glucose can cause glucose absorption of the eye, which will lead to a change in the shape and change of vision of the eye. Blurred vision is a common complaint leading to a diabetes diagnosis. A number of skin rashes that can occur in diabetes are collectively known as diabetic dermatomes. If you're unsure whether you have diabetes or not, there are other symptoms that occur that you should see a doctor about. The first one is increased urination and excessive thirst. The kidneys kick into higher gear, working to get rid of extra glucose in the body, hence the reason why you must relieve yourself more often. Excessive thirst comes along with this to replenish those lost fluids. Constant hunger is another sign of diabetes, since the blood sugar levels plummet, making the body think it hasn't been fed in a while and begins to crave more glucose.
Several tests are used to check if a patient has diabetes, one of which is the fasting plasma glucose test. This test checks your blood sugar after a night of not eating. On 2 occasions, if your blood glucose is above 126 milligrams per deciliter, this means you have diabetes. The regular cutoff is 99 milligrams per deciliter, and between 100 and 126 milligrams per deciliter is considered prediabetes, which is also a serious condition. Non-invasive devices also play a big role in evaluating and managing people with diabetes, including devices like magnetic and computed tomography. These devices assess changes in fat composition and distribution in the body, which may be affecting metabolic complications associated with diabetes. Therapies such as mind-body therapy, meditation, and massages are really healthy for diabetes.
Treatments vary on each individual rather than simply on the type of diabetes you have. The aim for diabetes treatment is to control blood sugar levels and to keep them as normal as possible. There are 4 main types of treatment: medication, insulin, transplants, and herbal remedies, along with alternative treatments. Diabetes medications are a common form of treatment with various types of medicine or anti-diabetic drugs. Insulin, which consists of beta cells in the pancreas, is very low in people with diabetes. Pills or insulin shots can be taken to help these people's bodies use the glucose for energy.
Lifestyle changes of diabetes. Food, exercise, and medication are the 3 most important lifestyle changes with diabetes. What you eat, how much you eat, and when you eat all affect your blood sugar levels. Healthy eating is key with diabetes. It is important to make sure you keep a regular eating schedule. Every meal you eat is well balanced, portion size is appropriate with each type of food, and finally, meals and medication are coordinated. Physical activity is another important part of diabetes management. Something you can do to manage the amount of physical activity you are getting is to talk to your doctor about an exercise plan you should be following. Before and after physical activity, your blood sugar levels should be checked, especially if you are on medications that lower your blood sugar levels. With physical activity, it is important to stay hydrated and adjust your exercise plan according to the medication you are taking, and whether you have to increase your plan or not. But when your diet and physical activity are not enough to manage diabetes, medications must also be taken. Insulin should be properly stored and only used before the expiration date to ensure it will be effective.
The National Diabetes Prevention Program, located in the U.S., can help people cut the risk of developing type 2 diabetes in half. Federal agencies, employers, insurers, community-based organizers, and healthcare professionals have collaborated to create this program for people of all ages. Participants of the program work with a lifestyle coach in a group setting to receive a 1-year lifestyle change program. The program involves incorporating the required amount of physical activity and healthy eating into the individual's life. 5 tips to preventing diabetes, if it is common in your family or you are an overweight individual, is to get more physical activity, get plenty of fiber, go for whole grains, lose extra weight, and skip fad diets just to make healthier choices.
How diabetes affects cells. People who have diabetes have a lack of insulin cells in their body. Insulin is produced in the organ called the pancreas. The function of the insulin is to allow glucose to get into the cells of the body. When insulin is low or absent in the body, the cells can't be fed the blood sugar they need. If the blood sugar can't get into the body cells, it then builds up in the bloodstream, and the sugar count increases on blood tests done. As the blood sugar continues to increase and can't get into the body cells, it affects the body by drawing water out of the cells, shrinking them and causing an unhealthy impact. Nerve cells, however, will let blood sugar in without insulin. Without insulin present, though, the sugar will not be used properly, resulting in accumulation in the cell. Blood vessels, also made up of cells, will swell up, causing a narrowing of the blood vessel while sugar builds up. The swelling of the cells will decrease circulation in the feet, the kidney, and the eyes. This is the main reason why people with diabetes may lose their legs, eyesight, and kidney function if they do not take care of themselves.
The risk of premature death is twice that of people who do not have diabetes. Prognosis depends on the type of diabetes and degree of blood sugar control. In type 1, around 15% of people with type 1 diabetes die before age 40. This can be improved, however, with good blood sugar control. In type 2 diabetes, as a result of diabetes, the life expectancy of people in their 40s can decrease between 5 to 10 years. Heart disease is the leading cause of death.
One of the days at work I passed out, just cold, and had no idea what was wrong with me, and I woke up and I was in the hospital, and I was being told that I was diabetic. And I had no understanding of what diabetes was. I instantly thought I was going to die because I heard disease. Okay, after disease there must be death. And I got a very quick education about what diabetes was, and I realized that I probably had it for most of my childhood, but when you're diabetic, nothing hurts.
Is this type 1?
It is really type 1, although it's classified now as type 2 because I'm no longer insulin dependent. I was for a while, and I've managed to wean myself off of insulin, so now I like to put myself in the type 2 category.
You control it with diet and with
Yes.
exercise?
Yes.
That's wonderful.
Yes.